several African countries, the Mpox disease is now said to be rapidly spreading in the West African nation of Sierra Leone, thus leaving some of the affected citizens raising concerns. Health authorities say the gained experience from the fight against Ebola and COVID-19 is helping them to contain the deadly disease as more precautionary measures are being deployed. Here's more details of that in this report.
This is just one of the over 1,600 Sierra Leoneans who have recovered from Mpox. For purposes of this report, we'll call him Alex. He got infected while on duty, but he sought treatment immediately. After 2 weeks under medical care, Alex is now fully recovered from the disease.
And it
It wasn't easy. It wasn't easy because I have seen different videos of how Mpox attacks and targets people. So I was down mentally and physically too. I wasn't okay because I recalled that I have a wife at home, though she can abstain. But I also have a young child who is 10 months old.
But I got a young pecan of the age of 10 months.
Mpox presents symptoms like fever, body aches and a rash. Alex is encouraging Sierra Leoneans to seek medical assistance as soon as they develop signs of infection.
Call on everybody for adhere to the precautionary measures.
I call on everyone to adhere to the precautionary measures the government has put in place because Mpox is real. Yes, for now, we notice that the death rates are low and people have the perception that Mpox doesn't kill, meaning it isn't bad. But after having gone through the virus, I know what I went through.
Health officials say the lessons learned from a serious Ebola outbreak in Sierra Leone and COVID-19 pandemic have helped them tackle the current Mpox outbreak more effectively and establish isolation centers in all districts across the country. The government is now focusing on vaccinating those facing a high risk of getting infected.
8.5 million people in this country, and we have 58,300 doses. So definitely, we have to prioritize. 1. Health workers who are in the front line. Contacts of infected persons, because if somebody is infected now, all those around that person are high-risk contacts. So we encourage those to be vaccinated and those that have other underlying ailments, like people that are immune to compromise. So these are actually the priority groups. So if we get more vaccines, we might even review those criteria.
People across Sierra Leone have been urged to avoid close contact with infected persons, practice good hygiene, and follow safety guidelines to prevent further spread of the disease.